you can get a cavity to remineralize, minerals to go back into it, and center of a tooth. It's quite easy to reverse a cavity, even if it's through into the dent. I want to explain the difference between a cavity and the disease that causes a cavity that we call caries or tooth decay. A cavity is the actual caving in of the structure of a tooth. And up until now, we've always believed that if the tooth caves in, you need to have a filling. If you use my complete mouth care system to some degree and potentially completely, you can get a cavity to remineralize, minerals to go back into it, and reform the structure of the tooth. Now, this will happen if the cavity is in the area where two teeth meet together. It's called an interproximal cavity. And I encourage you, if you've been shown on x-ray, to have an area like this, a kind of triangular area between two teeth or on two teeth. Use my complete mouth care system that I recommend, which is in detail on other videos and on my website at drellie.com. And you can use the products that I recommend and the strategies to actually put minerals back into this vacant looking space and repair so that you don't ever need a filling in that area. You can do the same thing if your cavity is in the center of the tooth, in the fissures, in the grooves of the center of a tooth. It's quite easy to reverse a cavity, even if it's through into the dentin, in the center of a tooth or on the side of the tooth. If you've lost an enormous chunk of your tooth, then yes, this may need a filling eventually. But I would still encourage you to use my complete mouth care system prior to having a filling done. Now, your dentist may cringe at this idea, but he will thank you, because when he comes to do the filling, not only will the tooth be less sensitive, the tooth will be stronger, he's less likely to chip away extra pieces of the tooth surface, and the gum, if it's the filling involves any gum area, your gums will be healthier, will bleed less. It'll be just generally easier for your dentist to do a good filling. So everybody should be on board. If you have a cavity, unless there's any nerve involvement and the tooth is dying, but if there's just a normal amount of sort of lost tooth, encourage you to spend 2 or 3 months cleaning up the tooth, cleaning up your mouth, getting rid of the disease in your mouth, and then go and have the filling done if the cavity didn't go away. I would do this with all my patients in my dental office. If you came in and you had a small cavity between your teeth, I would recommend, if you were interested, that you should go home, use the xylitol and this mouth rinses that I recommend, and try and reverse it. Now, what you're doing when you reverse the cavity is, the first thing is you have to get rid of the disease, because it is a disease, and these little stars represent the bacteria that cause the cavity in the first place. If you don't do that, even if you have this cavity filled, those disease bacteria are still in your mouth, and they're simply going to find the next tooth to attack. The disease doesn't go away unless you make it go away. And you don't make it go away with floss. You don't make it go away with a dental cleaning. Think about it. If those bacteria are floating around in your saliva, if they're in your mouth, you can have a dental cleaning. Before you're paying for the dental cleaning, they're back on your tooth again. And those are the bacteria that form plaque. Now, plaque bacteria need to be talked about, because most people do not understand how to get rid of plaque. Plaque cannot be removed from your mouth mechanically. You can't spit out plaque. You can't floss away plaque. It's not a substance. It's an infection that is in your mouth. And this infection will be not only coating your teeth, stuck tight against your teeth, but it's also floating in your saliva. These Streptococcus mutans is the name of the bacteria that are the ringleaders of the development of plaque in your mouth. And strep mutans floats around when we talk to one another. They are sprayed out in our saliva. If we share food, if we share drinking utensils, you're drinking soda and you share it with your friends, you may be sharing your mouth bacteria with them and they with you. Most people who live within a family, when we test their mouths, they have very similar bacteria. We know that a mother, when she kisses her baby, directly spreads from her mouth whatever bacteria in her mouth. If they're cavity-forming bacteria, she will spread them, share them with her children. So we need to do this as a family, as a community, as a group of friends. You are going to be sharing bacteria. And how do you, perhaps, let's start with, how do you protect yourself? I had a hygienist who was getting cavities and dental problems because her husband had bad oral health. He was somebody who wasn't interested in changing his mouth health. And she had tried all sorts of techniques to try to stop the cavities, stop the disease in her mouth. When she started using my complete mouth care system, we were able to show that she could prevent picking up the bacteria from her husband. So be very excited that the complete mouth care system I recommend is able to defend you from bacteria that come in from outside sources. Be also aware that these bacteria, they start life, Streptococcus mutans, as a small round seed, a kind of bacteria that looks a lot like a little tiny seed, a seed that you would grow a vegetable with. And they have a hard outer shell, which is why they are so difficult. And if you pick them up when you brush your teeth on your toothbrush, which you will, if they get in the depth of your toothbrush bristles, they will multiply and become more anaerobic. And when they're more anaerobic, they are more dangerous. Anaerobic plaque is far worse than immature plaque. And this is the reason that I recommend you dry your toothbrush for 24 hours between uses. If you soak your toothbrush, you're going to make your toothbrush bristles too soft. If you actually dry the toothbrush and air dry it away from your toilet area, your toothbrush should be clean the next time you use it, 24 hours later. But these little seeds, the Streptococcus mutans, if they're allowed to grow, and they change after 12 to 15 hours, they become meshed together with other bacteria. They actually feed on any sugars in your mouth, anything you're eating or drinking that contains sugar, whether it's a carbohydrate like a bread, pasta, a vegetable, fruits, any sugars can feed these Streptococcus mutans bacteria and make them stickier. That's what happens. And when they are sticky, they will attach to the tooth surfaces in your mouth. And on tooth surfaces, Streptococcus mutans require a hard, non-shedding surface on which to multiply. So they can't multiply in your saliva, you're safe. But the minute they get some sugar and they stick themselves to your teeth, that is when they get really busy multiplying, sticking to each other, sticking in layers to each other, and growing three-dimensionally. And that is the material, if you ever scrape white fluffy stuff off your teeth, or if you go to the dentist and are told you have tartar or calculus, this is a crusted form of this plaque in your mouth. It begins with this infection, and it begins because it's allowed to stay on your teeth, growing, multiplying, thickening, and it attracts more of the bad kinds of bacteria to itself. So it is a process, this decay process begins with bad bacteria liking each other, living together, creating acidity in the environment that they like. They like to be acidic. And unfortunately, those acids are the acids that dissolve your tooth surface and open it up for them to get inside, where they do the same thing over and over again. They create acids that dissolves your tooth. They creep in a bit deeper. They create more acids. They go in deeper. They literally bore through your tooth as a plaque entity. And that, combined with the soft, destroyed part of your tooth, is what a dentist will call caries. Caries is basically a mush made up, it's almost like a porridge texture of destroyed tooth with all these bacteria mixed into it. As a dentist, we pick up a drill or we pick up a little tiny spoon-shaped tool to scoop out this softened material. And the problem is, if it's been going on a long time, the softened material can go deeper and deeper and deeper into your tooth. The really cool thing about the program that I recommend is that the xylitol that I recommend and the mouth rinses that I recommend go into this space in your tooth that's being destroyed. And the xylitol inactivates plaque bacteria. It literally makes them immobile. They can't multiply. They cannot make acids anymore. They cannot stick to your tooth anymore. They cannot generate the damage that's being generated. So at least begin with taking xylitol at little intervals throughout the day. The other mouth rinses that I recommend travel in to get rid of the anaerobic bacteria, the ones that are extremely dangerous. If you've had this decay happening for a little while, these anaerobic bacteria are harder to get rid of. The xylitol may not be enough, but the products in my complete mouth care system get into that hole and deal with that anaerobic bacteria. The other products in my system, the Listerine and the Act, they go in there too. And they will also help get rid of the bad bacteria and harden up the caries. Harden up this porridgey, softened, disgusting mass of bacteria and dissolved tooth. And the caries will harden. And it will go on hardening. And I liken it to a scab. And this sometimes frightens people because they look at a brown area that was on their tooth and that will become darker. And they think that must be worse. But just like a scab, when you scab your knee, you graze your knee, it is the debris, it is the dying bacteria and the hardening tooth that you are seeing in this blackening area. And as the area gets dark, if you're lucky, underneath will be a healthy tooth regenerating itself. And it basically can regenerate itself underneath so that if you do need a filling for your dentist, he literally scoops out this kind of scabbed over decay, and underneath is a clean part of your tooth that is now solid, healthy, and ready. Perhaps he wants to scoop out the caries, the decay, and put in a little filling. It'll be quick, it'll be less painful, and it will be a nice, tidy, well-organized filling. When a dentist goes in and the decay just goes on forever, it's so hard to make sure that that tooth is truly cleaned. You'll lose a lot more tooth in the process. So that is the difference between a cavity and the decay process that we call caries. And I highly encourage you to get on my complete mouth care system before any dental visit for a filling and try and get your mouth healthy first. And then, even if you do need a filling, it's more likely to last for the rest of your life.